Today on Clubhouse Gas, another reason that girls have to be tougher than boys. It is our honor to be joined once again by friend of the show and director of sports medicine here at Children's Healthcare of Atlanta, Dr. David Marshall. Doc, thanks for joining us.
It's my pleasure. Thanks for having me back.
You recently wrote a blog for us at clubhousegas.com about ACL injuries.
Right.
And we all hear a lot about ACL injuries, and most sports fans know about them because if an ACL injury happens to their favorite player, they know they're done for the year. Your take on it was a little different. You were saying that far and away, more girls have ACL injuries than boys.
That's true.
What are the statistics, and why is that?
Well, first of all, ACL is the anterior cruciate ligament. That's the main ligament inside the knee that protects against rotational torques on the knee. And girls seem to outnumber boys really 5 to 7 to 1, depending on what study you need.
So it's not even close.
It's like a what?
It's not even close.
It's not even close. No, it's not even close to being even. It's 5 to 1 at least. Some say 7 to 1.
So there has to be some pretty concrete, serious reasons for that statistic to be so big. What do you attribute? Well,
there's basically biomechanical reasons that boys are structured different than girls. I've had people say that, well, that just proves that boys are better athletes than girls, but we know that's not true. That gets us into big trouble. But there's clearly some definable biomechanical differences that girls have from boys, and we can look at all the joints in the lower extremity, starting at the hips, going down to the knees, even into the ankles and feet, that make a big difference. And the first one really is the hips. That we know if you watch a girl jump, if you watch a girl land, when they land, their knees tend to go inwards. We call that valgus collapse. So they kind of take on a knock-kneed configuration when they land. Or if you watch a male or a boy jump, we really don't. When we land, we tend to keep our knees on top of our feet. And that keeps the knee joint functioning as a hinge joint. It doesn't allow it to start torquing sideways to become a ball and a socket joint. So just that torquing inward with landing or loading puts the ACL at risk in females.
And what causes the torquing inward?
Yeah, I think it's the core. The core strengthening and core stability seems to be a pretty hot topic in physical therapy or sports medicine. And more specifically with the females, it's the gluteus medius. It's the main external rotators or bringer-outers of the hip, if you will. And it's been shown biomechanically in the lab that in males, when we land, that muscle probably starts to fire even before we land. It actually anticipates the landing, so our body has learned through, I guess, evolution, how to protect itself. Where in females, when they land, that muscle remains idle throughout the landing cycle.
So girls have wider hips, which puts them at a different angle, and the muscles on the outsides of their hip fire at a different timing rate than guys?
In girls, usually they don't fire at all. That muscle remains idle throughout the landing cycle. So what we try to do is teach that muscle how to fire, not just with landing, but maybe before landing. If we can teach that female athlete how to anticipate landing through gluteal muscle firing, then we can maybe make their hips torque the same way, or not torque the same way for that matter, as boys.
Now, I've done a lot of coaching and been around a lot of coaches in my life, but I've never seen the gluteal firing drill. And I'm sure most guys watching this video have no idea how to do that. How do you coach that? How do you teach that?
Yeah, it takes time, because basically what we're doing is we're teaching girls how to fire their muscles in a different fashion. So it takes repetitive training through biofeedback, through repetition. Basically, muscle memory is what we're trying to do. And there's ACL prevention programs that seem to be popping up all over the country that are targeted towards young female athletes. They used to target the college or the NCAA athletes, but we found that it was too late. They've already torn their ACLs. And then they took it down to the high school athlete. Again, it might be too late. So really, it's the middle school age female athlete that we're targeting. And then the sports that seem to be the higher risk ACL sports are soccer and basketball. Those are the ones that involve a lot of repetitive cutting, pivoting, sudden change of directions with acceleration and deceleration.
With ACLs, it's lateral movement mostly that has the bad effect, or is it any kind of?
Well, it's a sudden change of movements. For example, like we said earlier, that the knee joint was designed to function as a hinge joint. It's supposed to bend and straighten in the frontal plane, and when it does that, the ACL, which is that ligament, isn't stressed. It's when they start to plant and then torque or rotate inwards for reasons that we talked about. When they torque inwards, now that lateral motion or that ball and socket function of the knee, now that puts that ACL at risk. So it just takes a plant and a sudden shifting inwards that cause that ACL to become stressed and probably tear. Most ACL injuries in female athletes nowadays are non-contact. You know, it's not like the Gail Sayers or the Ray Nitschkes where they take somebody else to blow into the side of their knee and have the whole thing explode inside. It's a sudden plant, change of directions, and that causes the ACL to pop.
This is why we have you on repeatedly. Anytime I can get a Ray Nitschke drop in on Clubhouse Gas, we're in good shape.
I could have thrown Dick Butkus in there too. You look like a Dick Butkus guy.
I'm a Nitschke guy. I wore 66 because of Nitschke.
Yeah.
What about the hamstring? You talk in the blog about the differences in the quad muscles and the hamstrings.
Right. Yeah, the hamstring muscles actually protect the ACL, where the quadricep muscles in the front actually work against the ACL. In other words, if you look at the knee model, if I pull the shin bone or the tibia forward, then that stresses the ACL. And that's what the quadriceps do. The quadriceps are the largest and strongest muscle we have in our body. As they come down, they grab onto the shin bone. So when the quadricep muscles contract to pull the shin upwards, just naturally through biomechanics, the shin bone or tibia wants to come forward, and that stresses the ACL. On the other hand, the hamstring muscles in the back attach back here, so they help try to keep the shin bone from coming forward. So really the hamstrings are protective of the ACL, the quadriceps work against it. And that's another difference that we find males versus females. In males, we tend to fire our hamstrings a split second before the quadricep muscle. So the hamstrings engage to try to hold that tibia in place, so when the quads contract, that knee joint is going to remain stable. Where in females, it's just the opposite. They tend to fire their quads a split second before their hamstrings, which gets that shin bone moving forward, which already puts the ACL at stress. So that shin coming forward, and then that rotational torque that we talked about, that's oftentimes enough to tear the ACL.
Is that something like with the glute muscle that coaches can work on the girls firing?
Through these training programs, they address all those issues. They address the gluteus medius or the external rotator firing, the core strength, and then firing and strengthening of the hamstring muscles to try to wake them up earlier in that landing, cutting, pivoting cycle.
Why do strength trainers and weight coaches at high schools not focus more on the hamstring? Why do we see kids not doing hamstring?
I think it's basically new information that we've known all along, that back since when we were kids back in the 20s playing sports, we've known all along that your quadricep muscles, your thigh muscles, they're the ones that give you power. That's how you drive the opponent off the ball. The hamstring muscles really we didn't really think about that as being helpful. Also, I like to use the term the mirror muscles, that when the kids like to work out, they look at themselves in the mirror and they think about the muscles they can see, which are the quadricep muscles. You don't really see the muscles in the back, or you don't really think about them as improving your physique.
Well, Dr. Marshall, we appreciate it. A lot of great information there. Any more questions? You can ask Dr. Marshall yourself. Just go up to our blogs tab, click there, read the ACL comments, or the ACL blog, and leave a question for Dr. Marshall, and he'll come right in there and answer it for you. That's going to do it for us today. We look forward to seeing you right back here next time for another great edition of Clubhouse Gas.